Hello, everyone, and welcome back to the Medboys Podcast, Episode 3. And I'm here with Nimit, and we have a special guest here for our COVID-19 special, Thushanth. Thushanth, would you like to introduce yourself to everyone?
Yeah. Hey everyone. Like Rushil introduced, my name is Thushanth, and I'm also a student alongside Nimit, Naman, and Rushil at UTSC in my second year. Um, just currently, I am helping out with the pandemic, in one of the hospitals in the GTA, in their emergency department.
Thushanth, what are you studying in U of T?
Yeah. So at UFT, right now I am majoring in human biology and neuroscience. Um, so yeah.
Did you want to take the MCAT after this year or maybe next year? Is that one of your goals?
Yeah, well, the idea is to hopefully either, go into medicine postgrad um, or sorry, post undergrad or go into graduate school, do some research. But yeah, hopefully the idea is to get into do my MCAT either this summer or next summer.
Yeah. So Tushant, the main question I wanted to ask you is, since you're a frontline worker and you're working directly at the hospital when we're in the middle of the pandemic and it's also at a very high peak right now, how did you get the motivation and why did you commit to this position? Because it's very dangerous and you could put a lot of people around you at risk.
Yeah, of course. And this was something that was in my mind for actually quite a while. In March, when the position became available. Prior to COVID, I was a volunteer in the same hospital, helping out with whether it be administrative work or patient care, patient transport, that sort of thing. So when this pandemic came into play, I just thought of it as something, for me to help out with patients, because that's exactly what I love doing. I love helping others. So just the idea of being able to support in any way possible to help out, in a hospital that's stretched and overwhelmed like that, I know it means a lot, but to me it just felt like something I should be doing.
And can you talk a little bit more about the state of the hospital right now? Just for reference, in Ontario, we're having about 3,000 cases every day. And yeah, I'll pass it over to you.
Yeah. So being in a hospital in the GTA, one of the hardest hit areas of the province, we are really seeing the worst of it. I personally know my hospital actually took out one of their general medicine wards, converted into a new CCU, and the old CCU became an ICU. So that just tells you, like, they're trying to expand ICU capacity. I know that one of our ICUs is basically almost or fully filled with COVID patients, either on ventilators or just needing support. So it really doesn't look good, right? Obviously, staff are taking a lot more precautions. There's a lot more triage questions being asked when someone comes into the hospital. So on all aspects, whether you're a COVID patient or you're not, you're going to be affected.
Yeah, so I actually just wanted to go back to what Nimit said before. From what you said, it seems like you've also had a lot of exposure to COVID-19 patients since you've been around them a lot. And so have all the frontline workers at hospitals. So um, did did you ever get the thought of, I'm assuming you live with your parents, right?
Yeah, that's correct.
Yeah, so did you ever get the thought that it might just be dangerous for your family in general? Or like what steps did you take to possibly isolate yourself from your parents?
Yeah, I mean, other than the hospital, I really don't go out. And whenever I'm at home, I try my best to keep to my room. Luckily, to this point, fortunately, nobody in my family that I know of has had COVID, which is a really fortunate aspect considering the exposure level. Being frontline workers, being essential workers. Honestly, I try my best to just keep to myself, not go out too much, not spend time closely with my family members, let alone just spend time with them for extended periods of time. Um, but yeah, just isolating myself, wearing a mask when needed to, in the car, wherever. So doing errands, that sort of thing.
And yeah, and just to emphasize, this is protocol that everyone should follow, regardless of whether you're a frontline worker or not. You should work to keep yourself safe, your family safe, and those around you safe as well. And since you are a frontline worker, I'm sure that you've had experience with the COVID-19 vaccine. So, would you like to speak a little bit on that experience you had? You know, what type of vaccine you took? Um, what were any symptoms you had? How were you feeling at the time? Just stuff like that.
Yeah, I know Nimit now and Rushil know by this point, but I did actually get the COVID vaccine a couple of days ago, when I first had the opportunity to. It was the Pfizer BioNTech vaccine. I think that's the name of it, but mainly the one from Pfizer. So up until this point, the only symptoms I've had was initially after the injection, I had soreness at the injection site. A little bit after that, just a little bit of fatigue, and in the days after, it just felt like I didn't work out on my at the injection site. That's what it felt like. It was just sore, no other symptoms whatsoever. Though.
Dusan, what's your opinion on people thinking that the vaccines are rushed, especially for the Moderna vaccine and also now the Pfizer vaccine, how they have different, I guess, effectiveness rates? What's your opinion on people thinking that this isn't just as effective since it's been a rushed, quote unquote, vaccine?
Yeah, well, I think we need to take into perspective how rushed we say these are. They are definitely faster than normal. I've heard that normally it takes about 5 to 10 years to develop a vaccine at normal funding rates. But with this vaccine, you have to take into account that the entirety of, the world wanted to pour money into this to eradicate this disease, and you also have to take into account how many researchers turned away from their personal research into COVID research to help out with this pandemic. So both of those definitely played a key factors. We saw multiple vaccine candidates not being able to pass through their clinical trials, and these clinical trials are very rigorous. At least from what I can tell, the federal drug administration as well as Health Canada, they don't approve these vaccines lightly. It's very hard to get them approved. I know this because I have a colleague who actually worked at Pfizer and said that drugs are hard to approve. So knowing this, knowing that it's a rigorous process, yes, it was fast, but only because we poured our resources into it. The resources were available, which is usually the bottleneck that prevents vaccines from being developed at the speed that the COVID vaccine was developed at.
Yeah, that's definitely true. And another point that I just want to add on to what Dushanth said is the fact that we've also had many scientific advancements in the past decade, from where we started by creating, the other vaccines like polio. There have just been many technological advancements, and as many of you all have heard, this vaccine is an mRNA vaccine. All of the COVID-19 vaccines are mRNA vaccines, and they don't work like normal vaccines that you would think of them as. They essentially code for the protein that increases your immune response to COVID-19, and that's essentially how these COVID-19 vaccines work. And it is a bit complicated, so I don't want to get too much into it. I think Thushanth wants to add something to that.
Yeah, I was actually going to extend that a little bit further, but Rushil toned it a little bit back. I just wanted to mention that typical vaccines, they're usually injecting the proteins, the antibody, or the proteins that would activate the antibodies in your body, to work against the disease. And really, having the mRNA vaccines helps us in the sense that, let's say there were any mutations. Typically, they only affect the protein. So by having the mRNA, you're actually helping get rid of a couple of mutations, like the new strains that we're seeing in the UK and Africa. Um, those won't necessarily affect the efficacy of the vaccine because of the technology being developed, and just really the vaccine development itself.
Yeah, but Dushanth, I wanted to ask you about what the process is like to get the vaccine, since there's obviously a lot of frontline workers. Luckily for in our country, there's a lot of frontline workers. And what's the actual process of getting the vaccine and seeing if if you might be, I guess, allergic to the ingredients or the ingredients might not be good for your body? How do you test it?
Yeah, yeah. So initially, when they started off giving the vaccines to healthcare workers and long-term care workers and residents, there was a lot of questions as to how would we be able to essentially provide vaccines to those that we know who have allergies. And so the guidelines Health Canada just recently proposed was that if you actually have had a vaccine to any food or allergy before, maybe think twice or ask your healthcare professional before you take this vaccine. And especially if you had an allergic reaction to a vaccine before, it's probably better if you don't take the vaccine, just because of the consequences of the effect of taking the vaccine. Now, as far as I can tell, the only major reactions that I've seen from the vaccine only occurred in those who've had severe reactions to vaccines before, not mild ones, right? And the other one was, so by the way, before I go on, for example, if you had like a bump at your injection site, there really wasn't a severe reaction to this vaccine either. And the three major cases in the US that actually had a severe reaction, they've all fully recovered. I believed a couple of them were hospitalized for a day or two, but that was it. And in my opinion, at least, that's way better than being infected with COVID and having the possibility to be on a ventilator.
Yeah.
You wanted to add something?
Yeah, I was just saying, like, I even got my flu shot a few months ago, and the pharmacist that gave me the flu shot told me to stay in the store for 10 minutes in case I did have an allergic reaction. So they, even for a flu shot, this process still keeps going. It's not just the COVID vaccine.
Yeah, and I just want to add in terms of the process of getting the vaccine, it was a little bit bottlenecked initially just because they wanted to make sure they had enough doses for everyone. But when you did get the vaccine, you just had to sign up for an appointment at the vaccine clinic, get your vaccine, and then once you got it, like Nimit said, they actually kept us in an observation room for 15 minutes, so just to make sure that we didn't have any severe reactions. And there were a lot of questions as to, whether you were a hemophiliac or whether you had any severe reactions before. So they are taking a lot of precautions in administering these vaccines because the last thing you want is for the vaccine to do more harm than it does good.
Yeah, exactly. And that's why those precautions are in place. And just another thing that I would like to add on the vaccine delivery, there actually has been initially, at least, there was a sort of shortage in, for example, even flu vaccines, like Nimit has recently got. There were like a large shortage in high dose flu vaccines, at least at the clinic that I work at. So that just shows you that a lot of people are in a sort of frenzy about COVID and not being able to confuse it with the flu.
Yeah, so just because we're talking about vaccines, I wanted to bring up, I guess, a controversial topic, which is people who don't actually want to take the vaccine. And Dushanth, since you're a frontline worker, what's your opinion on people uh, not deciding on taking the vaccine? Do you think it should be enforced on people to take the vaccine, or should it be a choice?
So I definitely think it should be a choice, and the reason why I say this is because I want to actually bring up another topic that's related to this, which is frontline and healthcare workers who believe that they don't, they don't want to take the vaccine, just in general or against taking the COVID vaccine. This may be for various reasons, from their development issues, to the allergic issues, and just in general, some people are opposed to vaccines. But sorry about that. Uh, Sorry about that. Can you hear me?
Yeah.
Yep.
All right. Yeah. So, like I was saying, they're just opposed to getting the vaccine in general. To these people, I just want to say it should really be a choice. You should, figure out whether or not you want to get the vaccine. And at least in my opinion, I would at least what do you call it? Weigh the consequences and the benefits to see which one is better for you personally. And for me personally, it was getting the vaccine, considering my exposure level and how many people I could affect as well.
Yeah, so because of that, I just wanted to bring up a statistic. According to NBC News, they said that about 50% of the frontline workers in California's Riverside County didn't want to take the vaccine, even though they are frontline workers and they get the most exposure. But anyways, Nimit, what do you think about frontline workers not taking the vaccine?
I think obviously we have to respect them. Like what Thushanth said, they have to have a choice. I understand that. But I think what an important thing is that frontline workers are also role models right now. And if these people don't decide to take these vaccines, a lot of people would be like, oh, these guys are on the front lines, they're getting exposure to the actual COVID-19 disease, are not taking it. So what's my reason of taking it? And like even Thushanth brought this up earlier. He said that there have been people who've been admitted who are actually pretty young. It doesn't have to be that you're old to actually get into the ICU or be on a ventilator. So even if you're not directly at risk, you might put someone else at risk.
And that's just another point that it's important to emphasize. And Thushanth, would you like to add something to that?
Yeah, I just wanted to say that we are seeing the brunt of this, and we are seeing the fact that I personally, and I've said this to Nam and Nimit and Rushil before, that personally I've seen pretty young people go on a ventilator and for quite some days. So yes, it could be a 96 or 99 whatever percent survival rate, but you have to realize that most of these people who are surviving, they are or not well, the people who are infected, a good portion of them are being hospitalized, a good portion of them are being treated in the ICU. So if it weren't for modern medicine, obviously the death rate would be higher.
Yeah, that's definitely a cause for concern. And another thing that I did want to bring up is actually Canada's vaccination timeline. And I just wanted to hear your thoughts about it. So currently what they're doing is that so obviously the vaccination started in 2020 December. And it's going towards April 2021. And throughout that time period, they want to immunize the priority population, which includes frontline workers like you and our seniors that work at and also staff that work at long-term care homes. And then after that, they're going to start the immunization of the general population. And while there have been adjustments made to this timeline, some people are saying that some of the entire vaccination protocol will be done in July or September. There have been many ideas floating about regarding the vaccination timeline. So do you have any sort of opinion on that? Because you are sort of, I guess, in the area of these vaccines.
Yeah, well, I just wanted to say that definitely priority groups must be prioritized. I mean, that's why they're priority groups in the first place. Because you have to think about, if you don't vaccinate these staff, and they do happen to contract the virus, or rather contract the virus, there's going to be problems in terms of staffing, in terms of who's going to help people or who's going to help the general populations when they contract the virus. And in terms of the timeline, I personally felt like there was a huge bottleneck, as in terms of vaccinating at my hospital. I know that it was super on the down low at first in terms of who was notified. So obviously, there wouldn't be logistical issues of you having hundreds of people or hundreds of staff line up for the vaccine. But at the same time, you have to think about that you're hearing there's reports out of the US that some hospitals are throwing out vaccines because they couldn't vaccinate enough people by the end of the day. Because you have to keep in mind, the Pfizer vaccine cannot be refrigerated, and the same goes for the Moderna vaccine, because the temperature changes are pretty big. And so you need to be able to find enough people to vaccinate, but at the same time keep it low enough so that you don't have hundreds of people lining up every day to get a vaccine, just waiting there.
That's one important factor, which is that you need to keep the vaccine very safe. And I think it's very hard for hospitals because you have to make space for everything, and most importantly, patients. But anyways, Thushanth, we want to thank you for coming in today to our podcast and talking about everything. And we're all really proud that we have friends like this who are frontline workers. And we want to thank you for your service and thank you for coming here today. But anyways,
I want to thank you guys for having me on the show today.
Yeah. Anyways, this concludes our podcast. Thank you, Thushanth. Thank you, Nimit and Rushil. And we'll see you guys next time.